Thank you everybody so much for coming out here today, and good morning. I want to let you know that there's a lot of hard work that's gone behind this launch, that Orange County Mayor Demings, City of Orlando Mayor Buddy Dyer, and behind me, Dr. Raul Pino, the health officer for the Florida Department of Health here in Orange County, will be unveiling to you this morning. So without further ado, I would like to go ahead and welcome Orange County Mayor Jerry Demings here to the podium to get this program started. Thank you so much.
All right, thank you, Despina. Thank you to all of you for being here today. We're here to kick off I Got My Shot campaign here within Orange County. We're going to tell you a lot more about what that campaign really means. We have a lot of trusted community partners who are going to participate with us today. For several weeks now, Orange County staff has been working on an initiative to combat vaccine hesitancy. Today we're joined with Orange County Commissioners Mayra Uribe, Commissioner Nicole Wilson, and School Board Superintendent Dr. Barbara Jenkins has joined us, and several other dignitaries that will be introduced to you in just a few moments. We have researched national trends to learn why people don't want the shot and are taking a wait-and-see approach to get vaccinated. We also conducted over 250 interviews through various focus groups to be able to address the community's concerns and apprehensions about the vaccine. From our research, the two biggest concerns of the wait-and-see attitude, vaccine groups are really concerned about access, availability of the shots, and the misperception that the shot gives you COVID. Nothing could be further from the truth. As part of the second phase of our Safer, Stronger Together initiative, the I Got My Shot campaign begins today to address vaccine hesitancy. The campaign will debunk vaccine myths, highlight trusted voices in the community, and encourage residents to get vaccinated and become advocates to their friends and families. I know it's very important for us to do this, especially with the recent developments regarding the Johnson & Johnson vaccine distribution. Once you are vaccinated, we will make it easy to be an advocate with buttons. I'm wearing one of the buttons today, stickers, face masks, and social media graphics for anyone to use in English, Spanish, and Haitian Creole. Another way we hope to get shots into the arms of our residents will be this mobile vaccination trailer that is behind me. Dr. Pino will talk more about the trailer in just a moment. Speaking of Dr. Pino, his team at the Florida Department of Health at Orange County and other leaders in the business and tourism industries have stepped up to partner with us. I would like to introduce some of our community partners at this time. We'll begin with Ms. Lauren Martinez, Vice President of Marketing and Communications for the Orlando Economic Partnership. She's waving her hand there in the back. Ms. Becca Bice, Vice President of Global Communications for Visit Orlando. Katie Kelly, Vice President of Worldwide Safety at Walt Disney World. Mr. Bob DeWoody, Vice President of Environmental Health and Safety at Universal Orlando. Along with our partners, our goal is to make all residents aware of the safety, convenience, and benefits of taking the vaccine and ensure they have access to help us build community immunity. Just visit our new webpage at ocfl.net/IGotMyShot, as well as our social media channels for more information. Our team will be providing campaign kits to leaders throughout the community, including elected officials, medical experts, and faith-based leaders to help us spread the word. In closing, I want to share my personal reason why I chose to get my shot. I chose to get my shot in order to protect my nearly 99-year-old father and my family and the others who come into my space on a daily basis. So we hope that you have a reason, a personal reason, that you choose to get the shot as well. Please join in the I Got My Shot campaign We are finally seeing the light at the end of the tunnel. Do your part to help our community get vaccinated and fight off COVID-19. So thank you, and now at this time it is my honor to introduce the Orlando Mayor, Buddy Dyer.
Good morning, and thank you, Mayor Demings. The last few weeks have really brought great hope for a better tomorrow, hope that we will return to our normal lives. And the biggest reason is because we've practiced our pandemic precautions, but more importantly, we have vaccine. And that is the reason we have so much hope. Throughout the pandemic, we've been united as a community. We've been united in our efforts to protect one another. We've been united in our efforts to assist our neighbors in need, in our gratitude to our first responders and our medical professionals and our frontline workers, and in support of our small businesses and our tourism industry. So more than a year ago, when the virus first impacted, we're still in this together. And that's why I am glad to join Mayor Demings and so many of the City of Orlando's partners in this campaign. Collaboration has always been the critical best piece for anything we do here in Orlando, and especially in times of need, to better serve our residents and effectively communicate. I got my shot like Mayor Demings back in December. When we received our first dose, we wanted to show that we had confidence in the vaccine and the guidance of the medical professionals, both here in our community and national, that have shared that these vaccines are safe and they're effective. And I received the vaccine also to help my family and my friends and every person in our community. The vaccine will prevent illness. The vaccine will prevent deaths from the virus. And we also, knowing that continuing to practice our pandemic precautions, and that's continuing to wear masks and watching our distance, can help prevent the spread of the virus. So ultimately, to protect and the well-being of everyone, it's critical that we continue our vaccination efforts. Residents getting the vaccine will help us on the path towards spending more time together, and just as importantly, it will help us move forward in terms of helping our businesses return to normal operations. So we all know that the vaccine is available to everybody 16 years and older, so everybody has an opportunity to participate. If you've already gotten your shot, I want to thank you. And I want you to become an advocate, encouraging others around you to get it as soon as possible. And if you haven't gotten your shot, today I would encourage you to start making plans on how you can do that to protect yourself, friends, family, and our economy. With that, I thank Mayor Demings and the county for organizing this and spearheading this, and I thank Dr. Pino and the healthcare professionals for everything that they've done to help our community safe. Dr. Pino.
Good morning. The timing could not be any better to have this campaign with the recent developments, and we didn't plan for it. The county didn't plan for it. But it's also timing in the sense that we are changing our strategy and how we are going to move vaccinations forward in our county. As we are reaching high percentages in some of the populations, especially over 65 is above 76%, and people over 40, we have vaccinated at least with one dose. About over 40 is about 25%, 50%, and for completed doses, serious, should be today above 25% when we get the data today. That means that 25% of the people in our county have received full dose vaccination, either 2 of the Moderna and Pfizer and 1 of the Johnson & Johnson. So the idea now, when we demobilize the convention center mass vaccination site, is to move closer to the communities and bring the vaccine closer to the people that need it the most. And the idea is to use data to be able to understand where are we having the lowest percentage of vaccinated individuals and move this vehicle that we acquire with the support from the county to provide those vaccines to our residents. The interesting thing is that in that strategy, we will prefer to use Johnson & Johnson because it's a vaccine that is only 1 dose, you're done, you don't have to go back to that place. And because you find hesitation also for people to take 2 shots instead of 1, so we thought that that would be an important element to have in this. So we want to reiterate to our community that we will wait for the results of the meeting today at the CDC advisory group, but this has been done out of extreme caution to be able to determine if there is a coincidence in these cases or is a link between the vaccine and the thromb that this female had experienced. And unfortunately, one female died, another one, I believe, is in critical condition. And no one wants this to happen to anyone. But looking statistically, this is 1 in a million right now, or a little bit, even more than 1 in a million. You have given about 8 million doses of Johnson & Johnson by now. These are 6 cases. So it's important also to have perspective. Even when you go to your doctor, let's say you are having heart surgery, and you say to the doctor, what are my chances of having a poor outcome during this procedure? And your doctor said to you, 1 in a million. You are going to say, I'm not that million. And you are going to go ahead and have the procedure. What is happening here is because we are giving so many vaccines in such a period of time, you are going to see side effects that it takes 10 years to experience. Because how long it takes to give 1 million vaccines for any other vaccines that we give in our community. We have never done this. Of course, we are going to experience side effects. It's how we respond to it and the ability to learn when it happened, how it happened, how it happens, and how can we prevent it in the future. So with that, we will take any questions and give you a tour of the trailer. But the idea again is to park this in a block, have Johnson & Johnson, yell out to our community, come and get your vaccine, and vaccinate people right closer to the homes. Because we understand the convention center is far, not everyone has a vehicle. It has met his mission of moving quickly. So our next steps must be going down into that community and vaccinating our school-age children. Thank you.
For media, I have a microphone.
Let me just also recognize some other dignitaries that joined us very quickly. We have Orange County Commissioner Maribel Gomez-Cordero, Orange County Fire Chief Jim Fitzgerald, Orlando Police Chief Orlando Rolón, who has joined us. County Administrator Byron Brooks has also joined us. And we have an entire team, our firefighter paramedics in the back here, who have been doing yeoman's work, getting people inoculated within our community. And so we do thank you all for the partnership. I'm going to turn it back over to Despina for additional details.
Media, now we're going to open it up for questions for 10 minutes. Please allow Mike Seif to work around with the boom mic. He's going to start from my left to my right, but please address your question to one of the representatives behind me, and they will step up to the podium. Thank you.
Hey, well, I'm really loud. Nadine with News 6. I actually have one question for Dr. Pino and one question for Mayor Demings. Dr. Pino, you had mentioned that you wanted to use Johnson & Johnson in these neighborhoods. The whole point of this is to combat vaccine hesitancy, which you said. So what is the strategy to overcome that hesitancy within the neighborhoods? Because these might be folks who haven't taken the initiative yet.
So in some cases, what we have done with congregating housing, and I don't know if we will be able to do this in the communities, but in congregating housing, we go a day before and have an question and answer event where residents can ask the questions that they have. And this could be something that we may be able to do too. Look for a location closer where we can bring the community if they have any questions about the vaccine. Much of it is also myth and hesitation based on past history. These vaccines are very effective. They are preventing. The data shows that we have dropped a hospitalization, death rate, and even infection rate in the group that have been vaccinated. So that's a clear indication that it works. Of course, as I said before, with any medical procedure of any kind, even a tooth extraction, you can experience side effects. It's also to know what those are, how they can be prevented, and how to treat them.
And Mayor Mayor Demings, my follow-up question is the governor has been pretty clear that we're not going to have vaccine passports here in the state. For tourism purposes, I've been covering that a lot. The goal is to make sure that we are safe, we are healthy, we are a vaccinated community. So how do you balance we're not having vaccine passports, but yet we're launching this campaign? And is that kind of what you're hoping the message is for folks outside of the state?
Well, I'm not sure if that's the right thing for our state or not, but in either case, what we are doing here is ensuring that we get as many people in our community vaccinated as we possibly can. To piggyback on something that Dr. Pino said, we are going to be rolling out a campaign here very soon where we have trusted voices from our community who represent the various diasporas and cultures and ethnic groups within our community who are going to be encouraging individuals to get vaccinated. You will see that collage of different testimonials being rolled out here very soon. But also, we have worked with our theme parks and our tourism community to ensure that they have the most current safety protocols in place, including the wearing of facial coverings, social distancing, and an abundance of other sanitary protocols have been put in place. We were leading the world in the living lab with the bubble involving the NBA and the Major League Soccer, two professional sports teams that really based upon how they dealt with things, sports really across America was able to get back and have in-person competitive sports because of some of the lessons learned from that process. There were no real outbreaks associated with that experiment, if you will. It was very successful. So our community has been leading by example. We put in place compliance teams that was designed to ensure that our businesses were following the guidelines that were being put in place. We had 99% compliance, and that is something that is extraordinary. So I believe that if anywhere can do it, we can do it right here in this community because we're working together through our Safer, Stronger Together campaign and the various other initiatives that we have. We've done a fantastic job of keeping our numbers low, relatively low. We never came really in danger of exceeding our hospital capacity. So I think we're prepared. We still need to get up to that herd immunity, and we get there, the sooner we get there, the better off we are. By getting vaccinated, that really helps to accelerate the period of time when we could get back to not being forced to wear masks within this community. So that's why we're encouraging everyone to get vaccinated.
If I heard Dr. Pino correctly, it sounded like you were hoping to use the Johnson & Johnson vaccine with this trailer. If today the pause continues, what are your plans for the future, and when can we potentially see this trailer in the community?
So the trailer has been out in the community as we were testing it already. Now we will probably develop a schedule and let you guys know in case that you want to see this in action, as long as we respect the privacy of the people that are getting vaccinated. With regard to the vaccine type, although that was our plan, we always develop B and C. And if this hesitation continues to be there and we cannot convince people to do this and use, we will have other vaccines to offer as well. We have not received yet the numbers of Johnson & Johnson that we are requesting to do this campaign, so we may be able to start with other type of vaccine. Again, the idea of part of the hesitation in our community for some people is to get 2 shots. And I think that this could help to accelerate that process if we are able to convince them that it's safe. But we will see what happens today with the meeting.
Mi pregunta para el doctor Pino, por favor, si nos puede responder en español.
Gracias.
Con respecto a un poco la campaña, si nos puede hacer un brief corto sobre la campaña, sobre todo en este momento que ha ocurrido lo de Johnson & Johnson. Quería saber también cuántas vacunas de Johnson & Johnson se han colocado en el condado, cuál sería el llamado para las personas que ya se han colocado la vacuna, si, o sea, tienen que estar pendientes, o el llamado a la calma que se le podría hacer a estas personas, y cómo afectaría esto en el proceso de vacunación, en la velocidad que lleva el proceso de vacunación en la región. ¿Cómo afectaría que ya no tengan la vacuna Johnson Johnson, que es de un solo shot?
So, yeah, all the questions she asked in Spanish, I already mentioned in English, so I'm going to go straight into the Spanish. La idea de usar la vacunación móvil es traerla cercana a nuestra comunidad y proveerle los servicios a la gente ahí mismo cerca de su casa. La idea es también de que personas que tienen problemas con automóviles o tienen problemas con quién cuida al niño o la mamá que no puede salir de la casa o la abuela que no maneja, es ofrecerle la posibilidad a todos de tener su vacuna cerca de la casa. Porque entendemos que el Convention Center no es un lugar para todos, pero es un lugar donde hemos podido dar el número más alto de vacunaciones. La idea también que me estaba preguntando de Johnson Johnson, no tengo los números exactos de cuántas personas se han vacunado con Johnson Johnson, pero los puedo tener listos para mañana. Y las personas que tienen preocupación con esta vacuna, todas las vacunas son muy seguras. Incluso con estos 6 casos, tengamos en cuenta que Johnson Johnson se han dado casi 8 millones de vacunas en el país. Incluso si estos casos estuviesen directamente relacionados con la vacuna, lo cual no sabemos, eso lo sabremos hoy, continúa siendo una baja probabilidad, es más de 1 en 1 millón. Entonces, las vacunas continúan siendo seguras. Lo que está sucediendo es que como estamos dando tantas vacunas en un periodo tan corto de tiempo y tenemos tanta atención de los medios, pues estas cosas salen a la atención mucho más grande de lo que realmente son.
Hey, this is Melissa Thomas of Florida National News. This question could be for Dr. Pino or Mayor Demings. Just kind of talk about the simplicity of people being able, the accessibility of people being able to get the vaccines in terms of technology. I know one of the challenges in some of the more underserved neighborhoods is not only access of being able to drive or things like that, or if they're kind of shut in, but also any difficulties that they were having with any of the portals. So would a trail like this be able to kind of alleviate that issue as well?
The question regarding will this trailer be able to help us ensure better accessibility to our residents who desire to be vaccinated? And the answer is yes, because this is a mobile trailer that was acquired for about $80,000, and to wrap it in the special wrapping was about $5,500. Our goal is to strategically place it throughout Orange County at various times to reach some of those underserved communities. We have used our 311 call system to assist individuals who could not perhaps get internet access. We understand that there is a broadband divide within our nation that will be addressed soon, but in the interim, we have created systems in place where both in the city and the county, we have used our neighborhood community centers as places where individuals who, if need assistance, they are able to go to those locations to get assistance to be able to make appointments and to traverse the system of care that we have put in place here within our community.
Doctor Pino, una pregunta. A raíz del anuncio de ayer de la FDA, ¿han visto disminuida la cantidad de personas en los centros de vacunación o no? ¿O no ha sentido ese impacto?
No. The question was, have we seen a decrease in the number of case appointments since the announcement yesterday on Johnson Johnson? No. At the convention center, we are giving Pfizer at this time. It could be that we may give Moderna a couple of days this week or next week because we had received some additional Moderna. But we have never used Johnson Johnson at the convention center, again, because it's a design issue in the sense that we have designed that for 2 doses, and the 1 dose we have reserved for these cases that we talked to you about it. And I realized that I'm answering in English, so I'm going to go in Spanish. So la situación no ha traído ninguna disminución del número de citas en el Convention Center, porque ahí no estamos dando Johnson Johnson. Ahí por ahora tenemos Pfizer y vamos a tener Moderna tal vez 2 días esta semana. El Johnson Johnson nosotros lo hemos reservado, como dije originalmente, para los lugares donde tenemos dificultad yendo por segunda vez, porque es una sola dosis. Entonces, por ejemplo, movilizar todo este tipo de equipo requiere tiempo, trabajo y gasto. Eso es mejor hacerlo de una vez y eso es lo que estamos tratando de hacer.
Doctor Pino, Roxana de la Riva para el periódico La Prensa en Español, por favor. Al principio, organizaciones comunitarias latinas tuvieron una alianza con el gobierno del estado de Florida para registrar y traer a las comunidades a vacunarse. Esto se hizo en supermercados y se fue a pedirles que se registraran si ellos lo querían. ¿Ustedes van a hacer eso en algún momento, una alianza con comunidades latinas para ir a supermercados o a ir a los vecindarios?
So the question was if we were building any alliances with Latino community organizations to increase vaccination intake in the Latino community. We are using those alliances for all communities, not only the Latino community. And part of the process that the fire department in our county and the city of Orlando has so done, and the state, in some of the areas where they have moved the mobile sites, is the day before there is a canvassing of the area, informing everyone that the vaccines are going to be that day. We think that is very effective in this type of approach. En español, tenemos alianza con muchas comunidades, muchos grupos comunitarios, y esta es una muestra de lo que estamos haciendo. Y también el Departamento de Bomberos del condado y de la ciudad, y en conjunto con el Estado, ha hecho a canvassing de las áreas en las que vamos a tener las vacunaciones, y de esa manera le informamos con antelación a las personas que los servicios van a estar ahí tal día a tal hora, y le damos la oportunidad de registrarse con antelación también.
Okay, before we break to tour the mobile trailer here, I want to just make an announcement that the trailer is going to be deployed immediately after this press event for a mission where we will be providing vaccinations to our homeless community. The trailer will be relocated to our parking lot just on the east side of the building here, where the courier lane will be, and we will be inoculating approximately 75 individuals who have been identified as being homeless within our community. So with that, let me just say thank you for joining us today. We'll conclude the formal portion of this press briefing, and then we'll invite you to take some pictures inside. Thank you very much.
Go ahead and call our partners up to the table here for an official photo.